Hey guys, welcome to Basically Physio. Today in the Rehab Assessment Basics Series Part 2, we'll be talking about manual muscle testing. And why we want to assess the manual muscle testing is because we want to find out which are the problematic muscles or the weak muscles that are causing inefficient movements or pain patterns. And secondly, once you test which of the muscle group is weak, then you can prescribe your rehab exercises accordingly. So there are two ways that you can check the manual muscle test. First is by group muscle test, whereby you just check for gross movements in a joint itself. Secondly is the individual muscle test, whereby you look out for certain specific muscles, for example the pectoralis major, and try to isolate it and test it just by itself. So for the group muscle testing, you can think of it like a general screening test for each of the joint. The joints here that are listed are the main joints that you'll be testing for. For example, if you want to check the shoulder flexion, then you just do a gross screening movement and check the strength for that. Next is the individual muscle testing. So you are actually looking at a specific muscle or muscle group that you are testing. For example, in shoulder abduction, you actually want to test for the deltoids or the supraspinatus. Then there are specific ways that you can actually isolate or more like emphasize on certain angles to pull out the muscle that you really want to test. So that is the individual muscle testing. So the muscle groups testing is more applicable in, for example, like an inpatient physiotherapy assessment session, whereby you just want to quickly screen the joints and whether this patient is able to perform certain movements such as hip extension, bridging, knee extension. This will give you a gross idea of whether this patient is strong or weak, just very grossly. Now for the individual muscle testing, this will be in a more like a MSK outpatient clinic setting, whereby the client or the patient has a specific complaint at maybe at a certain angle of shoulder abduction. Then you would want to do individual muscle testings for each of the shoulder muscles. This is the scale here. It goes from 0 to 5 and the definitions are stated here. So some scales actually have things like 1 plus, 2 minus, 3 plus, 4 minus, things like that. But just to keep things simple and basic, we'll be just looking at this scale only, 0 to 5. So some things to take note is that you do not want your clients to be wearing tight clothes, and you also want to make sure that the area is free of injury or any recent procedures being done on the area. And next thing, you want to make sure that your patient is not holding their breath while doing the testing. For individual muscle testing, if you're very keen to learn more about it, you can purchase this book with the link below. And this book is by Clarkson. It's a very useful book to test for individual muscle testing. So one of the limitations of MMT is that even though it gives you a 0 to 5 rating, it actually does not truly quantify the strength of the muscle. To truly quantify the strength of the muscle, you will need specialized equipment such as the hand dynamometer. To overcome this, you can consider doing functional assessment tests, for example a 5-time sit-to-stand test. And what this is able to tell you is that whether the patient has the ability to perform daily functional movement rather than just a score of 0 to 5. To the end of Rehab Assessment Series Part 2. To look at Part 1, which is the range of motion, you can click this video here.